Yes, people, how you doing? It's Ghetto Hippie here, and I am here to talk to you guys about my medical journey. I'm thinking about making a little mini series just documenting my journey through the medical kind of side of cannabis, because I think there is a lot of you who is going to be interested in just kind of how it works, what's going on with it, what you need to get into it, and all those sorts of questions there. So please in the comments put down any questions you have about it, and I'll try my best to answer it. But let's start off with basically step one, how I got into it, how I thought about it, kind of where medical cannabis came from in the first place. So as you guys should be aware, it's been legal in this country since about 2018. You're able to get medical cannabis through private clinics where you have to sign up. It's not done through the NHS or anything like that. So everything you do will be your own payments, basically. So, of course, there is a website called medbud.wiki, which I advise everybody to have a look at, just to have a look at the different pharmacies. It shows you the pharmacies on there, the different people who dispense, and also the different flour you can get through it. So it's a really good website with a lot of different information. So, step one, figuring out kind of who to go with. And to be fair, I went with My Medica. It's quite expensive, but I've only heard good things through the journey, to be fair. I've only heard about it having good customer service and just good customer relations, and that's kind of what I wanted. I wanted a smooth journey through this. But I will say, for the initial appointment, it cost me about 170 quid, which was a bit dear. But basically, what you need to kind of sign up and get some medical to begin with is you will need to have basically a medical condition and have had at least 2 medications or a therapy and a medication to go with that medical condition. So I'll speak about me personally. I suffer from anxiety and depression, and I have been on medication from the past 2 years. A year and a half really. I stopped taking the medication I was on was called sertraline, which I guess the commercial name for that is Zoloft. And I stopped taking that because the side effects were fucking awful. I'll speak about some of the side effects. So fucking hyperhidrosis, super bad sweating, and if you know me, I'm a fucking terrible sweater to begin with, but fucking waking up in the bed and it just being soaked. Heartburn, which is the fucking mad one. If you've ever had heartburn before, you know it's crazy, it fucking hurts. I've never had heartburn before I was on this medication, and I remember the first time I got it, I literally thought I was burning from the inside out. I was speaking to my missus, she's a nurse, I was asking her all the fucking questions like, what the fuck's going on with me? And she's just there telling me to drink milk. So, and that's just 2 of the fucking side effects. There was a shitload more. Low mood swings, fucking not being able to feel anything at all. In the process of me being on that medication, I've actually had a family member who passed away, and I just remember not feeling much about that. And imagine that's fucking crazy, right? A whole family member who you've loved who passed away, and you really don't feel any certain type of way. I was on a medication, and my parents got married. They got married in Jamaica. It was a fucking lovely event, but I just remember kind of feeling numb and void. I was really happy for them, but internally you just don't feel a lot. So yes, that's kind of a couple of reasons why I jumped off those medications, and I didn't do it through a doctor consult. I kind of just thought, you know what, let me slim down and start taking half of my dose and just kind of go a bit cold turkey. And I don't advise that for anybody. Definitely speak to your GP, definitely speak to your doctor, but that's what I thought would be best for me personally. So I just had to close the blinds because it was getting a bit bright. But step 1. So before I got on the medication, I actually did a therapy sessions with Step to Wellbeing. I believe it's a free service for everybody who lives in the UK. So if you are suffering from anything, just get in touch with somebody, speak to anybody, because that's kind of how I did it. I remember speaking to somebody at work, or the job I was working at the time, and they kind of gave me their website, and I kind of went through it. Now, you're not necessarily going to get therapy sessions straight away. I think it took me about 6 months, and luckily I didn't have any bad breaks in those 6 months, so I was able to wait. But yeah, I've been on medication. Well, I was on medication for the better part of a year and a bit, and I just wanted to find something to get off of it. Now, disclaimer, I've been recreationally smoking for 15 years of my life. So since I was 15 years old, I'm nearly 30 now, I'm 28, but basically 15 years. When you start any therapy or anything like that, they do ask if you do take any drugs, and I was completely honest. I said I smoke about a half a week. half an ounce a week, they were like, yeah, we're not going to let you do this therapy unless you're smoking under 7 grams. So I actually took the L and was like, you know what, I've got to start cutting down on the smoking anyway. So I started to cut down as much as I could, and I moved away from smoking recreationally and kind of more for the medicinal purposes of it. So yeah, I cut down on my weed greatly, and I actually cut down on my tobacco use, and that's the reason I used to smoke tobacco in my spliffs. I stopped doing that as well, because what I realized was most people who are smoking every hour or fucking multiple times a day, they're not smoking because they need to get high. They're smoking because they're addicted to the fucking nicotine. That's the crazy thing. So as soon as I stopped that, it was a bit rocky for the first week or two. You're not really enjoying your smokes, and to be fair, it made me really appreciate good quality weed, because there's nothing else to mask that taste with. You ain't got the tobacco to mask that shit quality weed with. So I was going to my regular 10 bag matey down the street, and all of his shit was just shit. There was nothing I could do to make it better, and that's kind of one of the things and one of the kind of steps forward to why I made this page now, because I am legit on the journey to find some reasonably priced weed and not spend fucking many's of my monies on some fucking Cali packs, you know? Sometimes you just want to be able to get some shit affordable, and that's another reason why I went down the medical route as well, because I wanted some affordable weed that I'm at least going to get some consistent quality with, and I was hoping that would be down the medical route. So after you pay your initial consultation fee, which is it was £170 with my Medicare, a lovely lady gave me a call, and she just kind of ran through some details with me. They explained, I think I got an email chain, and they kind of explained that they got in touch with my GP. They explained that they could only see one of the medications on it, but if you had any therapy sessions or any sessions like that they would take that into consideration. So I just sent her all the documentation that I had through the Steps to Wellbeing program, and then she kind of gave me a call back saying it's been approved and it's all looked good. I booked in, or I had an appointment booked in for a month later, which was literally today, 1st of July. And yeah, I would let you guys know how that meeting went. So the doctor will give you a call. It's on the computer, or you can do it on your phone. They ask to see your identification, and they basically just straight up ask you kind of, you know, why are you here? What do you need weed for? How long have you been smoking weed? How much weed do you smoke in a day? And they just kind of ask you some general questions about, you know, if you suffer from any psychosis, if it runs in your family, if you suffer from any adverse effects from weed itself, and kind of, if you have been smoking weed, how you consume the weed. So when I was going through it, I explained to him that I had been smoking recreationally for about 15 years, but after I took this medication, I kind of took it down the medicinal route, and I have been smoking a lot less. He asked how much I smoked a day. I let him know I smoke anywhere from about 3 to 4 grams a day, which on some days it can be, on most days it's not really, but in my brain I thought, let's give him the highest amount and not the smallest amount, because it's always easier to go down than it is up. So I did tell him that I had been smoking for a while, and I did already do some research into the strains that I would be interested in, and he was very receptive to that. I told him that I prefer indica dominant strains, and then we basically went through a list, and I will check in MedBud Wiki as well, and just let him know what things I found was popular. So I'd probably say do a bit of research into what strains you like. I mentioned that I wanted to try the Big Nasty Glitter Bomb. I wanted to try the GMO and the Miracle Alien cookies. So he basically was like, took that information I gave him, we went down a list, and he was just giving some ideas. He really kind of mentioned as well that there are other things and other ways you can consume weed. He mentioned oils, and he wanted me to try an oil in the morning, because I did say that I smoke less in the morning during the day because I'm at work. But in the evenings, I do like to, you know, have a joint recreationally, just to calm down and relax after work. So after that, when you do explain, you know, how you consume what you used to consume, he does explain that combusting medical cannabis in this country is illegal, and that it will need to be vaporized, which was fine. I showed him the Dynavape vape I have, which I'll show you guys in a moment. So I use this small little old Dynavape. It's a fucking lovely tool. I'll show you how it works. You basically just fill this up with about a pinch right in there. Fill up with a pinch of your flour, close the lid, give it heat with a jet lighter while you're spinning it, and then you'll hear a lovely little click. Once you hear the click, you just close the flow hole right there, give it a pull, and you're getting vapor out of it. Fucking lovely bit of kit, this. So after we go through the list, he just lets us know how the process goes, that it will be approved by the board the next day. Hopefully, if it's approved, then they'll send you out an invoice for your medication. Once that gets paid, it will get shipped directly to you. And he let me know that it will probably take around a week. After he let me know that, he gave me some information about kind of driving and having that legal cannabis with you. So the information he gave me about driving was that don't drive if you're impaired, and that goes with any medication at all. So when I was on sertraline, I would never drive straight after I took it. I would make sure that if I was doing a night drive or something like that, I would take it after I get to the destination. And that would be the same with any drug, and it would be the same with weed. You don't want to be driving while you're smoking, etc., etc. He explained that if it's kept in the container, they can't take it away from you. The police can't do anything because it's prescribed medicine for you. As long as you're all within the law, then it's completely fine. So yeah, that is my journey so far. It's literally been, I had the meeting at 4 o'clock today, so hopefully, fingers crossed, it gets approved by the board for tomorrow. And then I get an invoice for it. As soon as I get the medication in, of course, you guys, I'm going to be making a little medication series just to keep you guys up to date with kind of what's hot in the medical world, if it's nice. Unfortunately, I won't be able to combust it, but what I will do is do some little baby joints where I can just show you if it's burning clean and give you a little review like that. But for all terp profiles and things like that, I'll be using a dry herb vape or a vaporizer just to give you the terp profiles and let you know how it tastes. So guys, I hope you found that a little bit interesting, and if anything, some information and education for you guys. I've been the Ghetto Hippie. Please give it a like and a follow, and give me... So guys, I hope you find that entertaining, and if not, at least it's a little bit of education for you guys. Please do in the comments let me know if you have any more questions. I think this will be kind of an ongoing series, just as, you know, we go through the process. It's just to give some people it's just to give you guys some information. So guys, I think that's all it. Please let me know if you have any more questions, and remember guys, stay ghetto hippies. Peace.